Welcome back. Once again, it's Sue, who's answering a few questions about her journey. She's a breast cancer survivor. Today, Sue, I want to ask you about the aesthetics part of your journey. I know it might sound a bit artificial, however, this is something that women especially think about the second that they are recommended that they go through chemo. What did you go through? Lashes, I remember you coming to the shop. She did quite a good job at maintaining. So give it a bit of a story.
Yes, unfortunately, chemotherapy changes a person basically, and my face, I was seeing my face changing, and I didn't want my kids to see me differently. Even my husband to see me differently. So basically, I tried to make a lot of effort. I used to come here buy the false eyelashes,
Yes, I remember.
but with magnetic because I had no
No
nowhere
hair
no
to stick
hair
on.
to stick on. So
But she used to do a very good job, huh?
and
Practice makes perfect.
I tried my best. In the mornings when I wake up, I used to put on makeup. Still, I mean, obviously, the creams and everything, you have to be very careful during the treatment. So
Yes. In fact, this morning, this is all about awareness. Even I wasn't aware. Our therapist is actually qualified to give advice on what to use and more importantly, as you were saying, what not to use during chemo and how to maintain your skin because skin changes, it becomes more dry, many cases, right?
definitely more sensitive as well. So yes, for sure. I mean, it has to be the treatment. If it has to be really specific, and
Exactly.
the
So you
the,
get the
the
right
creams
advice.
have to be specific. Ask advice to the oncologist. It's very important.
Having said that, mind you, I know I followed Sue throughout her journey and she used to look very close to what she looks like today.
I tried my best. I
used to
tried.
be self-conscious because obviously you were aware of your changes. However, it is possible to feel or at least look normal as much as possible because mentally you feel better, right?
Definitely.
It's another very important question and perhaps something that we wonder about, especially someone who hasn't gone through it or has just been diagnosed, is the final part of your reconstruction. Breast cancer, we initially think, we're going to get our breast removed. What are the stages? What do you recommend? What's advice?
I wish I was. I mean, you have to be more informative. Basically, you have to do your research and everything. Thank God, Mother Day offers the reconstruction process.
Okay, so it's not an extra expense from your end.
And basically, they did support me
Very
through
good.
that. I had
important.
few complications, but because it was because of radiation, etc. So I had to have delayed reconstruction. But in my mind, I always
okay, that's
kept.
good to know because, for example, since I'm not very much, I'm not aware. I always thought that it's something expense of the patient. So no, it is actually part of the treatment. So at least there's a bit of positivity, and God bless, nowadays you are going through the reconstruction phase.
Yes, definitely, and I'm very happy the doctors do amazing job.
Okay. Anyone who wishes to get free advice from Sue, Sue is part of Europa Donna. She gives.
We support patients.
Support.
I mean, we have a professional counselor who give advice professionally, and we offer that. But if someone wants to reach out, because I passed through the process to like to just talk to me or anything, just feel free and speak to me.
At the end of the day, that's the whole concept of our little awareness. It's a little campaign because we meet a lot of women, even in the shop, who come in, they worry about certain aesthetics and even certain, obviously, health issues. However, it's good to talk one-on-one. So there you go. We'll be back with another question next one.